Thank you very much. I want to apologize again today that we don't have an ASL interpreter. One wasn't available for us today, so we'll have interpretation on video as well as full captioning available by tomorrow. Oh, hi, Rita. I'm going to start with the latest COVID numbers here in Boston, in Massachusetts. These are numbers as of yesterday. 4,358 new confirmed cases in the Commonwealth of Massachusetts. 60 new deaths were reported yesterday, bringing the death total in Massachusetts to 12,401. Our Boston numbers, the new numbers did not come out today, so I have as of yesterday's numbers. 431 new confirmed cases, bringing our total cases in Boston to 41,847. We had 2 deaths reported yesterday, bringing our death total in the city to 1,020 people have lost their life. Our prayers go out to the families who have lost loved ones, and also our prayers go out to the families who are fighting, their loved ones are fighting, particularly anyone who's on ventilators right now in the Boston hospital or any hospital in the country. Our latest complete test data is for the week ending December 30th. An average of 4,561 people were tested each day. That's down compared to the week before. It's down about 22%. The reason for it is the holiday season. Some days we were closed, and a lot of people didn't take the opportunity to get tested during that week. This does not include college testing, as I always say, so our testing when I report here does not include the college testing. The average number of positive tests each day for Boston residents went up to 413. That's up slightly compared to the week before, about 3% compared to the week before. Our current community positivity rate is 8.8%, and that too is up from the week before, about 2.3% higher. If you notice our individual day, the 413 average test scores, that's with fewer tests. So we can make an assumption that if we had more tests, we'd have higher rates here in the city. Dorchester, Hyde Park, East Boston, and Roxbury are the neighborhoods with the highest positivity rate. Our case numbers certainly are concerning, as I just mentioned about if we took more tests, we would have higher positivity rates. Our hospital numbers are also up higher than certainly we'd like to see them. 93% of adult non-surge ICU beds are occupied. This is the highest that we've seen in quite some time here in the city. We're in constant contact with the hospitals, and we just need to continue to remind everyone to do your part. This is one of the most serious points of the pandemic so far. If the numbers don't improve, we'll be forced to look at more restrictions. So we need people to continue to wear masks. We need people to continue to avoid large crowds and stay 6 feet apart from each other. We're asking people to continually wash your hands and do everything to make sure you keep yourself safe. Every time you do these things, you could be saving a life, your own, a family member, or somebody that you don't know, a complete stranger. We'll beat this thing if everyone continues to buckle down. As far as in mid-December, I announced that Boston would temporarily pause our reopening and move back to a modified Phase 2, Step 2 for at least 3 weeks. This was an effort and is an effort to slow the spread, to protect hospital capacity, and avoid a more severe shutdown later. We are taking a cautious approach, doing what's right here in the city of Boston. Given the high numbers that we're seeing today in the last several weeks, we're extending this pause for at least another 3 weeks until January 27th. That means indoor gatherings will stay limited to 10 people. Outdoor gatherings will stay limited to 25 people. These numbers apply to public and private spaces. The following activities will remain closed for at least 3 weeks, and this is a list that I certainly don't like to say this, but we have to do this because of where we are with the virus. Gyms, indoor fitness centers, health clubs will stay closed for general use. One-on-one personal training sessions are allowed. Movie theaters, museums, and aquariums will stay closed. Indoor athletics facilities will stay closed except for youth 18 or under. This does not apply to college or pro sports. Indoor pools may remain open with safety protocols that are put in place. Batting cages, driving ranges, bowling alleys, rock climbing will stay closed. Sightseeing and organized tours will stay closed. Indoor historic sites will stay closed. Indoor event space will stay closed. Indoor and outdoor gaming arcades will stay closed. The following activities are allowed to stay open. Indoor instructional classes for youth can continue with a 10-person limit. Outdoor event spaces can continue within the 25-person limit. Outdoor theaters and performance venues can continue to operate within the 25-person limit, and movie and TV productions can continue to operate. Per the state guidance that went into effect on December 26th, these activities will continue with the following restrictions in place. Office space can stay open at 25% capacity. I urge employers to allow any employee who wants to work from home that can work from home to allow them to work from home. Indoor dining can continue at 25% capacity with a 90-minute limit on seating. In Boston, bar seating is prohibited without approval from the Boston Licensing Board. Salons, barbers, and other close contact personal services can stay open with a 25% capacity. Places of worship can stay open with a 25% capacity. Retail business can stay open also with a 25% capacity. Golf facilities can stay open with up to a 25% capacity. This is not a complete list, so if you're looking for a list of what can be open, what is open, and what is not open, we can go to boston.gov/reopening. I want to be clear, this is not about targeting specific sectors as a cause of the virus spread. This is an effort to reduce the overall activity happening outside of people's homes. In another 3 weeks, we're going to reevaluate the situation. If the metrics have moved in the right direction, then we'll be able to lift the restrictions, and I hope and pray that we'll be able to do that. If the metrics get worse, or even before that, we might have to put in place further restrictions. Again, I'm asking everyone to do your part. Help us beat this thing once and for all. I want to talk briefly about safe dining. And we continue to watch the data. We're limiting indoor dining capacity at levels the public health experts say and feel that are safe right now. Thank you to our local restaurants for following the safety protocols. Many of our restaurants have done an amazing job following the safety protocols. They've been cooperative. We're supporting them with small business relief funds, technical support, and outdoor dining. We're trying to make it easy for them to offer pickup and delivery services at their restaurants. But we need patrons to do your part. Our contract tracing efforts have made it clear, even though indoor dining itself isn't a high-risk factor, too many people are going out to dinner with people outside of their households, outside of their bubble. People have a few drinks and they kind of wander around. Sometimes they see other people and they table hop. We need this to stop. You can't have you table hopping in a restaurant. We need to keep local restaurants open, but only if people follow the public health guidelines. If you're indoor dining, we're asking you to only go with people in your bubble. Keep your mask on when you're not eating. Don't mingle with other tables. It's not just about your safety, it's about the hardworking waitresses and waiters, hosts, busboys, and people that are working to make sure they can earn a living. We're asking you to be respectful, and we're asking you to help spread the word. Testing is certainly one of the tools that we have. We have over 30 testing sites in the city of Boston. If you think you may have been exposed, we're asking you to get tested. If you travel for the holidays, we're asking you to get tested. It's been a while since your last test, we're asking you to get tested again. Getting tested regularly, we're asking you to make it a New Year's resolution. We have mobile sites which are free and open to all, regardless of symptoms. This week they're in Hyde Park at the Boston Renaissance School. This is a drive-through only site that you have to make an appointment. In Roxbury at the Washington Park Mall, this is a walk-up site and registration is required. And in Jamaica Plain at the Anna Cole Community Center, this is a walk-up site, no appointment or registration is required, but we ask you to be patient. If you go there, you'll be waiting in line to get tested. For more information, and it goes quickly. For more information, visit boston.gov or call 311. On the vaccine front, the CDC came out with guidelines for the vaccination plan, and each state has adopted a plan. Massachusetts created a distribution schedule prioritizing the highest risk residents. For full information on that, you can go to mass.gov. The city of Boston is following the state's lead. We're working with the state. Last week, Boston EMTs and residents and staff at long-term care facilities started to get vaccinated. Yesterday, the governor announced all first responders throughout Massachusetts will begin getting the COVID vaccine starting on January 11th. That includes EMTs, firefighters, and police officers. We have about 1,500 slots here in the city of Boston for first responders to get vaccinated next week in partnership with the Tufts Medical Center. We urge everyone to get vaccinated when your time comes. It's safe, it's free, it's the best way to protect yourself and your loved ones in your city. Ever since the pandemic has began here, we've gotten creative about our favorite traditions and keeping those favorite traditions moving forward. Next Tuesday, January 12th, I'll give my annual State of the City address. This event will be entirely virtual. I'll discuss how the city came together to face the challenge of this past year, and I'll lay out a plan for a strong and equitable recovery moving into 2021. More than ever, this year's State of the City is about the people of Boston. It's about how we shared hopes for our future. It begins at 7:30 p.m. It will be broadcast live on local TV stations and live streamed on boston.gov. I encourage everyone to tune in. We've worked incredibly hard over this past year to care for the sick and struggling and to launch a strong recovery. The steps we've taken in this new year will be pivotal. So let's continue to stand strong. There are many reasons to be hopeful, but that doesn't mean any of us should let our guard down. If anything, now is the time to double down on our efforts to keep ourselves safe and keep our families safe. 2020 was one of the hardest years in Boston's history, and I believe 2020 will be our proudest. I want to thank everyone for doing their part, and now I'll open up for questions.
What do you need to see in the next 3 weeks for these restrictions on gyms and museums and all the restrictions you listed to be lifted?
Yeah, great question. The question is, what do I have to see in the next 3 weeks for these restrictions to be lifted? We have to start to see a decline in our daily cases. We've seen a pretty steady rising of numbers every single day for the last, I'd say, almost 2 months now. We are getting to a point where it's getting very dangerous, getting to a point where it's very dangerous for hospitalization. We're seeing these numbers get higher. There's lots of, I think I was watching on one of the stations last night about the virus that's, the strand of the virus that was in England that is now here. It's a more contagious. It's I don't know if it's in Boston, but it's on the East Coast. So we have to be watching all this. So we need to see some declines in numbers. We'd like to see ideally 2 weeks of decline in numbers, but at this point, I think we'd take 5 or 6 days before we start to ease some of these restrictions that we put in place here in the city.
Mayor, how much longer can we sustain what we're doing in the city, financially, economically, and people are. We walk around the city, obviously, we've seen depressing.
The question is, how long can the city sustain the economic, I guess, downturn, if you will, if you want to, for lack of a better word. I'll answer that in 2 ways. One is the city's budget. We've, in my 7 years as mayor, we've been preparing for a downturn in the economy. We haven't seen necessarily that downturn complete yet, but certainly we've seen the impacts of it. But when it comes to businesses, I don't think businesses can last a lot longer, particularly our small businesses, our restaurants, our retail shops, some of our corner stores in our neighborhoods. That's why I can't stress enough the importance of wearing the masks, really trying to isolate as best as possible from other people. That's the way we stop the spread. I've heard too many stories of people having a party, and even within City Hall now, somebody comes into the workplace, they're not feeling well, and they test positive for COVID. Now all of a sudden everyone's on protocol, so people are missing work. So we're really asking you to keep the signs, take your temperature. If you're not feeling well, contact your doctor. Haven't said that in a while. If you feel you get a cold or a cough or something, headache, contact your primary care. Just take all the precautions, because the more we do this, if we can get through these next 2 months without having to shut everything down again, I think that will be beneficial to our small businesses. England yesterday and the UK just shut down for a month. Ireland is shut down. Other European countries are shut down. Canada has done a pretty good job of managing the virus by not letting people in and physical distancing and doing that. We can do that here, and that's something that we can all do, and we have to continue to do. Later on today, I'll get criticized for extending the moratorium, if you will, on step 2, phase 2. People will come to me and say that it's not in our business. It's not in our business that the virus is being spread. And as I mentioned, that might be true, but what we want to do is try and keep community spread down as much as possible and keep those potentials for contact down. I don't want to be standing here as mayor at the beginning of the new year talking about shutting businesses down. What I want to do is be opening up this city. I'm hopeful by the summertime I'll be able to see people back on the streets and get our tourism back, get our economy back, get our restaurants full of people again. But if we don't take the precautions now, that will not happen. We've been saying this now for 7 months, and we're still seeing now a surge in the virus. So we have to do everything we can to get those numbers down.
How concerned are you
about people being reluctant to take it? And for first responders, do you think maybe you should mandate that police, fire, EMTs take the vaccine?
It's pretty hard to mandate. For people to take the vaccine. Some people have their own reasons for not taking it or their own discomfort for not taking it. Certainly when it's available for me, I'm going to take the vaccine. There's been the test and has proven to work. I'm encouraging all first responders to take the vaccine. I'm encouraging everyone right now that has the potential, the opportunity, I should say, to get the vaccine shot. I think it's really important for you. It's important for us to continue the idea of herd immunity, and the vaccine will give us that immunity that we need to be able to combat this virus. But I don't think it's my place. I never felt it's my place to mandate to somebody they have to take a vaccine. If they don't feel comfortable taking a vaccine, then that's their personal choice. I'll come back to you.
Communities of color, where traditionally we've had a lot of people say, listen, I don't trust the government. They've done things to us in the past. How can you break through to your communities?
Yeah, that's a great point. We're working right now to figure out how we're going to be able to market to communities of color, to the African American community, the Latino community, to let people know the importance of taking this vaccine. I think we have some work to do. I think we have a lot of work to do in society. There is a lack of trust in the healthcare system. And I think that, we're going to need the healthcare system to help us to rebuild that trust, along with local leaders, activists, and other folks that we're going to be leaning on to help us, including police and fire and EMS. I think some of our officers will be able to help us with that as well, messaging.
That things in the city that you don't see working on enough to really make that change because of the key clients, right?
Yeah, I actually think it's working. I think what we're doing is working. I think that if we weren't communicating to people and we weren't getting information out every day, our numbers would be far worse than they are today. So I do think it's working. I think that I think what's happening now is that some people are unintentionally letting their guard down. And thinking that, it's safe to be, we see each other every day, we're in the workplace, so we kind of hang out, so we're safe, but no one knows when everyone. That's why I ask people to stay in your bubble, your family bubble, so you know where everyone was. But I think that we kind of let our guard down. Like all of us, for example, here, we see each other, a couple times a week. We feel like we can talk to each other, and you just don't know. We don't know where anyone else has been, and that's what happens when they let our guard down.
There were more killings in the city this year. There were more shootings in the city this past year. Can you just speak to that?
Yeah, I think that this year we did see an increase in homicide rate in the city of Boston, and we saw an increase in shootings. We're at about our 7-year average, which we haven't seen the spike that other cities certainly experienced. I was talking to mayors from around the country. They saw a very big number jump. But as I've said in the past, one homicide is too many in the city of Boston. There is no question in my mind that coronavirus has added to that, has added desperation, and created that opportunity helped create that opportunity for more violence in the city. I think that, when you look at the second half of the year, when we're able to get our street workers back out in the street and we're able to engage our community residents and activists again, we saw that number go down a bit. Where we saw the spike in violence really was in the height of the pandemic. So we just have to continue to stay vigilant. Again, we pulled a lot of people off the street. Police were out there doing their job, but street workers were off the street. We didn't have the safety net programs. We didn't have all of what we didn't have school going. So I think that we've readjusted and we're taking a different approach now. And hopefully in 2021 we can get those numbers back down. One life is too much to be lost to violence in the city, any city, but in Boston in particular. So we're going to do everything we can to get that violence down.
Mayor,
I'll come right back. To you.
In what scenario perspective are you optimistic that 2021 will be?
Yeah, our police department does an amazing job. Our police department, when you look at the work that they've done in the last 7 years, the amount of guns they've taken off the street, our arrests are down in the city of Boston over 30%, and that's from resolving conflict. That's not from not doing their job. That's from resolving conflict. This has been 2020 was a difficult year for a lot of people, but one thing I'm proud of, the police department continue to do their job, continue to move forward, continue to build trust, continue to keep our streets safe, and we just have to continue to build on that. And I do feel confident that I'm hopeful that we'll have a more peaceful 2021. Certainly something that that we're going to focus on. I talk to the commissioner every single day, and since I've been mayor, I've talked to the commissioner every day. It's one of the areas that people want to be able to go outside their home and feel safe, and we have to make sure the city of Boston's safe for them. Yeah.
Mayor, on the labor secretary rumors, has the Biden team reached out to you or your team during the past month about the labor secretary post?
Yeah, what I've been focused on, quite honestly, in the last 9 months, and in particular the last 5 days, is focusing on COVID-19 in the city of Boston. I'm going to stay focused on that. I'm going to stay focused on my State of the City, which is coming up next Tuesday. There's going to be whatever the speculation is or whatever the talk is, I'm going to let that going. There's certainly lots of rumors yesterday that I heard as well as you did. I read the story in the paper today. I am focused on getting these numbers down. I'm focused on getting Boston through the pandemic. I'm focused on, in the next couple of weeks here, starting to build a budget as we move forward for the next fiscal year. So I really don't have anything other than that to say.
Do you have any interest in that gig?
I love being mayor of Boston.
If the president-elect were to ask you to be labor secretary, is there any world in which you say no to that?
You can't really. I don't want to speculate on something like that. That's all speculation. So I'm not going to answer a speculation question.
Just a quick follow-up on the vaccinations. What kind of spots would you be using? You were tough. You said 350 spots, and then will you be using Fenway at all?
Yeah, the state is working right now with Fenway. The state's working in collaborating where these sites are going to be. We're working, the city's working with the state as well. We need to get some sites into our communities. Again, we're laying down, we've laid down the foundation. We're going to increase that foundation as more and more vaccines become available. But the state is kind of leading that charge right now. But we are, Rita Nueve, the director of our Public Health Commission, is here with me today, and we're working to start thinking about when we start getting larger amounts of vaccines, making sure we get out to people. What we don't want to have is hundreds of thousands of vaccines here in the city of Boston sitting in a freezer somewhere or on a shelf, however you store it. Different vaccines are stored different ways. We want to make sure we get them into people's arms, get them into their bodies so that they can feel safe, and that the people that want the vaccine can get the vaccines.
And just to reiterate, the first responders are going to be doing theirs at Tufts Medical?
At Tufts Medical next week, starting on the 12th, 11th. Yeah. Yeah, they're all going to be there right now. I think that the state's still working. I don't think the Fenway Park thing is finalized. I think the state's working on that now, and the state's working in other sites around the Commonwealth of Massachusetts.
Have you heard from the Boston Police Patrolmen's Association or the Firefighters Union about resistance to taking the vaccine?
No, they're actually quite the opposite. People are anxious to get it. They're front-facing, and they've been, on the front line since the beginning of the pandemic. I mean, they can't get a day off. You have to do your job. There's no way around it. So there are officers that are in that age that are a little older, and firefighters a little older, and that they're worried in pre-existing health conditions. They're worried as well. So I've heard nothing but people wanting to get the test, get the vaccine quicker. And unfortunately, we couldn't get it done quicker, so we have it for next week, and we'll be able to get it to people. Thanks, everyone.